Good morning, good evening, hello to everybody. I'm Juan Uribe, the Global Director for Health, Nutrition, and Population in the World Bank, and the Director of the Global Financing Facility for Women, Adolescents, and Children's Health. And it's a pleasure for me to be moderating this report launch event. It's a very timely and important report, a flagship report brought by the HMP team in the bank on resilience and health systems. Change cannot wait. Building resilient health systems in the shadow of COVID-19. I want to thank all who are participating today in this event, and I want also to appreciate everybody who has worked behind this flagship report that is going to be extremely useful and helpful for our countries in strengthening their health systems. With that brief introduction, let me now turn it over for the opening remarks to Mamta Murthi, our Vice President for Human Development, who will be highlighting the importance and the timing of this report. Mamta, welcome, and over to you.
Thank you, Juan Pablo. Good morning, good afternoon, good evening to viewers all around the world, and also welcome to our distinguished guests. The COVID-19 pandemic has shown the world that fundamental change in health systems cannot wait. The probability of a pandemic like COVID-19 occurring sometime in the next few decades is not unlikely. And this is because of increasing risk drivers. We all know about urbanization, about climate change, about land use changes. Then there's fragility and conflict, and there are ongoing zoonotic spillovers. All of these will have a significant impact on people's lives and the human capital of countries. That's why we want to emphasize something that we know already, but is perhaps neglected. And that is that investing consistently in health system resilience during non-crisis times reaps benefits that far outweigh the costs when emergencies occur. And that is really the task at hand. Now, today we are launching a new report, and this report importantly discusses the kinds of actions and investments that it will take to build resilient health systems. We are going to learn about these actions, and we're also going to hear from government ministers on the challenges that they face in implementing these actions. Now, our report, which is based on a lot of analysis, including an analysis of how countries responded to COVID, presents a roadmap of actions that countries would need to take in order to operationalize resilience. And it also presents a framework for prioritizing investments. This is especially important at this time when fiscal constraints are tight and possibly becoming tighter. As we show in this report, these investments will help countries prepare for, withstand, and manage acute health shocks, while at the same time maintaining essential health service delivery. Now, we'll say a lot in the upcoming panel and in the launch on the report itself. So let me highlight three considerations that really stand out from the report. The first is that health governance and improved health governance is at the foundation of resilience and should be a top priority. If COVID-19 has shown anything, it's a powerful reminder of the importance of evidence-based decision-making processes, risk-informed planning, adequate legal and regulatory frameworks, and the need for strong public health institutions. The second thing that the report highlights is that resilience, while it depends on the health sector, goes beyond the health sector, and it requires strong cross-sectoral approaches and partnerships, as well as a One Health approach. This includes partnerships with civil society actors, as well as with the private sector, as this is essential in order to have coordination, joint planning, and implementation of activities that strengthen resilience. Last and not least, health systems resilience needs to be country-led and based on both health equity and health security. This includes a focus on early warning systems, very strong public health institutions, an agile health workforce, community engagement, and of course, strong primary healthcare. To conclude, I believe what today's launch and today's discussion will show is that strong defenses can only be built on strong foundations. The time to build our defenses is now, before the next public health emergency overwhelms health systems again. With that, I want to thank you all for participating, and let me hand it back to Dr. Juan Pablo Uribe.
Mamta, thanks so much for those remarks. An investment pathway with very clear decisions and efforts to be done to strengthen those foundational elements, governance, the multi-sectoral approach, and strong public health as core messages there. Let's now move on and see a video before going to the report's authors, who will come with a presentation. Over with the video, please.
COVID-19 showed the world that fundamental change in health systems cannot wait. Countries need health systems that are resilient to shocks while continuing essential health services. But what is a resilient health system? Resilient health systems are aware of threats, agile in response to evolving needs, absorbative to contain shocks, adaptive to minimize disruptions, and transformative based on lessons learned. Resilient health systems go beyond the health sector and mitigate other challenges such as aging populations, chronic disease burdens, and climate change. To boost health system resilience, countries need to invest in stronger public health institutions, improve early warning functions, expand community health workforce, and strengthen community engagement. Countries must prioritize equity and investments that strengthen public health functions, focus on pandemic preparedness and prevention, and primary health care. Let's work together to make health systems more resilient, to better protect and invest in people.
Great. Thanks so much for that very interesting video, which is going to be expanded right now with the brief presentation that the authors leading this flagship report will share now with us. So it's a pleasure for me to introduce Sulzhan Bali and Zara Shubber, who have done a great effort leading the team behind this report. And we now have them with us to, in the next 10 to 15 minutes, share the most important findings and recommendations on this flagship on building resilient health systems. Sulzhan and Zara, with a great appreciation for your leadership, over to you.
Great, thank you very much, Juan Pablo. Good morning, good afternoon, and good evening to all our viewers around the world. It's a pleasure to launch our report today on health system resilience. I just want to make sure that the presentation is up. Thanks. Great, thank you very much. So if we can move to the next slide, please. So the first question I want to cover in our presentation is why? Why the focus on health system resilience? So what COVID showed us is the price that we pay if we are not prepared and we don't have resilient health systems. COVID had a devastating impact on human capital. As all of you know, the pandemic killed millions of people and triggered significant life expectancy losses in many parts of the world. But while this is staggering, this is just this is only a part of the picture. At the peak of the pandemic, for example, more than 1 billion children were out of school, resulting in increased learning poverty that's going to stay with these children for many years to come. And with the economic downturn, millions of people were pushed into extreme poverty. Next, please. So the second question that I want to answer is, what do we mean by resilience? So while we recognize that resilience can be a broad term, in our report, we define resilient health systems as systems that are integrated, that are aware of threats and risk drivers. In other words, they can recognize population health needs and detect threats. They are agile health systems in the sense that they can respond to evolving needs and uncertainties. They're also systems that are absorptive to contain shocks and adaptive to minimize disruptions to essential health functions through, for example, altered standards of care and alternate service delivery site. And finally, resilient health systems are transformative health systems. They can transform based on lessons learned. And I think the integrated component is really critical, both in terms of integrating preparedness and essential public health functions with health service delivery, but also, as we saw in the video, the fact that it mitigate the impacts of other long-term challenges such as aging and chronic disease comorbidities. Next slide, please. And so the third question I want to answer before I pass to Susan is, how do we build resilience? So in our report, we identified two main types of levers that governments have in building health system resilience, what we call enablers and core health system capacities. So enablers are cross-cutting actions that have an impact on all aspects of health system performance. These include governance, partnerships, health financing, human resources, and innovation. And in terms of the core capacities, we include the capacity to generate and use health intelligence, service delivery, community engagement and risk communication, and of course, the health supply chain. And then in the middle of the slide, what you can see are the resilience functions that I just talked about and that we saw in the video. And on the right, you can see how these functions improve outcomes both during crisis and in the inter-crisis periods towards the achievement of health security and universal health coverage, whereby individuals and communities can receive the essential health services that they need without financial hardship along the life course. And then in the report, what we talk about is a resilience dividend, the economic benefits that we can reap through averting crisis, through improving health outcomes both before, during, and after crises, and through the promotion and preservation of human capital. I now want to pass over to Susan, who will take us through the key actions that the countries can take in building health system resilience. Thanks, and over to you, Susan.
Thank you so much, Zara, for this introduction. So next slide, please. So there are obviously, as Zara mentioned, there are several cross-cutting enablers that where targeted actions can strengthen health system resilience. To start with governance, as we all know that decision-making and governance had determined the effectiveness of response during COVID-19. It had a profound impact on the trajectory of the crisis. So really, some of the actions include focus on, number one, decision-making processes, including evidence-based decision-making. For example, having scientific advisory boards and so on, having strong public health institutions, that is key, as well as updating legal and regulatory frameworks for crisis. Last but not the least in this, really having agile planning that incorporates risk and learnings from prior crises. And there are several examples in the report, such as South Korea, which did that as well. Next, partnership. We are cognizant that health sector cannot build resilient health systems alone. We need to work with the other sectors and closely. So we know some of the actions include really strengthening the multi-sectoral partnerships through, such as setting up a One Health coordination platform, could be one. Strengthening regional partnerships, which renders efficiency gains as well as promotes collective action. Strengthening engagement with the private sector and civil society through a fit-for-purpose engagement strategy, as well as having prior agreements in place. So these are some of the examples how partnerships can strengthen health system resilience and the various functions that Zara talked about, including agility, awareness, and so on. Third, in terms of health financing, there's a critical need to prioritize, protect, and track investments in pandemic prevention, preparedness, and response. And again, there are some great examples of this. We have examples such as Vietnam, which sets aside part of its health budget to focus on pandemic prevention, preparedness, and response, or Uganda, which really sets aside part of its budget to focus on contingency financing. So prioritize, protection, and tracking investments in PPR is key. Setting up contingency funds for health emergencies, and not just one kind. We need disaster risk layering here. We need multiple tools that can deal with different kinds of acute health shocks. That is key. Last but not the least, with a view on equity, reducing financial barriers to access for essential health services, especially in crisis. We learned that was really critical when it came to demand for interventions, but at the same time, to prevent the disruption of essential services, which caused such a devastating impact on the human capital. In terms of human resources, really focusing on community health workforce would be key. They are the cornerstone of a resilient health system. At the same time, repurposing and diversifying health workforce through task shifting or reallocation of health workforce, or bringing other sectors together through training would be key. Building multidisciplinary and frontline competencies for PPR through field epidemiology training. And we saw during the pandemic, countries that had invested in FETP were able to leverage that for contact tracing. Similarly, actually, even for community health workforce, we have examples such as Thailand, which had village health volunteers that were able to contribute to the response efforts. Last but not the least, also protecting our healthcare workers. We've lost between 115 to 180,000 healthcare workers between 2020 to 2021 alone. And I believe that may be a conservative estimate. So really focusing on providing PPE, IPC, infection prevention control training to our healthcare workers is key. The last enabler I'd like to talk about is really innovation, strengthening in an agile regulatory system that can fast track new technology and new interventions with an accelerated timeline through expedited reviews could be one, for example, would be key. Last but not the least, strengthening collaboration and capacity for research, including through regional partnerships, would be critical. We saw the important role research plays in strengthening resilience, and that would be a very important point when it comes to innovation. Next slide, please. In terms of the core capacities, which are also influenced by those cross-cutting enablers, we highlight health intelligence, health service delivery, community engagement, and supply chain. As we learned, strong early warning surveillance and epidemic intelligence functions are key. And what do I mean by that? Having community-based surveillance, having cross-border point of entry surveillance, having cross-sectoral surveillance to prevent the spillovers is critical. At the same time, we learned from COVID-19 pandemic that digital tools can be a really great asset when it comes to strengthening contact tracing and active surveillance, as well as new technology for data collection and analysis. At the same time, we need to integrate our information systems between the PPR and health service delivery, also a very core point when it comes to really focusing on the data side. In terms of health service delivery, really, that again is the most critical part of strengthening a resilient health systems and to ensure that there are no disruptions. Number one, really assessing the facility readiness for shocks, making sure they're crisis ready. Having such as, through developing essential service continuity plans, to what to do in case you can have adapted models of care, alternate service delivery sites. These were very effectively used by many countries during the COVID-19 pandemic. Most importantly, strengthening our primary healthcare system, which is the first point of contact for service delivery. So really focusing on a primary healthcare with an integrated public health function would be key. And that could include, for example, helping our frontline health workers do sample collection, providing them with PPE. So those are some examples of that. Developing coordinated network of health facilities. In terms of community engagement, we realized that was also a really important aspect to cover. We saw misinformation happen, we saw rumors happen, and not just during COVID-19, even prior health crisis, we've seen that. So really developing your risk communication processes and build capacity for risk communication is critical. But at the same time, not a top-down approach, maybe also having listening to the communities of their concerns. So having a two-way risk communication rather than just a top-down risk communication. At the same time, including community representatives in decision-making bodies is critical here. It allows us to ensure that the interventions are well received. And there are some examples of that. For example, in Indonesia, the religious bodies, they were included so that they were able to refer that the vaccine could be considered halal. That strengthened the acceptance and demand of COVID-19 vaccines in countries. So that would be key. And then again, strengthening rumor and misinformation monitoring to address the challenges that can be posed with misinformation as well as infodemics. Last but not the least, supply chain. It's an integral part, but very often undervalued. We need to ensure we are investing in crisis-ready supply chains that have forecasting capacities, logistics plans for emergencies, rational use guidances in place. At the same time, ramping up a domestic production capacity for production of medical goods, including not just through domestic production, through regional cooperation. And we saw several examples, of that. One being in point, how Africa CDC was able to work with the countries to strengthen regional procurement during the COVID-19 crisis. Next slide, please. So Zara talked about the first framework that showed the targeted investments. We have another framework that upholds this report, and that is how should countries look at prioritizing. Countries can strengthen health system resilience in 3 tiers: the pre-crisis tiers, before the event, at the time when an event occurs, and then really surge, which is when the event becomes a full-fledged crisis. We have so far mostly focused on the 3rd tier. It's time we focus on the pre-crisis tiers equally and address the neglect there. With shrinking health budgets following the COVID-19 crisis response, countries need to set priorities for high-yield resilience spending. Foundational investments in these pre-crisis tiers that strengthen community preparedness and risk reduction, as well as strengthen detection, containment, and mitigation is key. And they yield a high return on investment. For example, public health yields a median of $14 for every dollar invested. So investing in these foundational tier 1 and tier 2 is as important as focusing on tier 3. At the same time, investment in health system resilience actions, including investments in PPR or pandemic prevention and preparedness and response, significantly lowers the cost on human capital at the time of an event occurs. And it's much less than a full-fledged cost of epidemic. As Mamta mentioned earlier in her remarks, the frequency of acute health crises, including epidemics, is increasing. We are more likely to see this. So as it is even more important that we invest in health system resilience now. The time to build our defenses is now, before the next crisis overwhelms the system. Thank you so much. Back to you, Juan Pablo.
Thanks so much, Sulzhan and Zara, for this very concise summary of a report that will allow us to go with a lot of detail into all of these very important components and capabilities that together build resilience in our health systems. Now, it is our pleasure to move to a really interesting panel with distinguished members who are going to be sharing with us their experience in the front line, leading their countries in strengthening resilience in their health systems as they went through the challenges brought by COVID-19. So it's for us a pleasure to introduce His Excellency Minister Kwaku from Ghana, Her Excellency Minister Leopo from Bhutan, and also the Executive Director of WACI, Rosemary, Mburu. We're delighted that you've been able to join us today in this flagship report and that you can share with us those experiences that, again, you had in resilience within your health systems, which are going to be experiences extremely helpful for all the other countries and for all of us. So welcoming all of you again. What we want to do in the next 30 minutes is to try to share a couple of questions with each one of you. We will start with individual questions and then go back if the time allows us. And at the end of your questions, we're going to be joined by Feng Zhao, Practice Manager for South Asia, who has been behind this report also for many months, and who will wrap the panel with some comments building on your experience. So with that said, let me, Your Excellency Minister Kwaku, very nice seeing you again, by the way, start with you. During the COVID pandemic, essential services were disrupted in most of our countries. Ghana, led by you, had critical investments which allowed it to prevent, to a great extent, the disruption of those essential services. Could you share with us briefly, in your opinion, what could be an example of a critical investment that Ghana advanced to be able, again, to maintain essential services while at the same time confronting a challenge like the one posed by COVID-19? Over to you, Minister Kwaku.
Thank you very much, Juan Pablo. Ghana adopted an all-hands-on-deck approach to the COVID-19 response. There was a high-level government commitment led by our president, which complemented the efforts of the technical teams at the national and sub-national levels. Key strategies were adopted by government to secure essential services. With that, community engagement and risk communication was highly adopted. The population's concern over safety of health facilities and the fear of contracting the virus while receiving care was one key factor that affected healthcare utilization during the peak of the pandemic. The government, based on this observation, reinforced risk community and community engagement right from the presidency to the community level by the government community health workers. At the national level, the president and the technical heads of the health service engaged the public on a regular basis, while the healthcare workers and government agencies in charge of public education engaged the community using existing community engagement mechanisms. And we have our public health emergency committees at the national level, at the regional level, at the district level, where our traditional leaders, our community health workers, civil society, district directors for health are all involved in making decisions and discussing as to how we should approach the emergency. We made investments in infection prevention and control. Right from the start, we made heavy investments in procurement of PPEs, sanitizers, and fumigation exercises with the aim to achieve secured and safe environment at all health facilities. In fact, we even fumigated some of our markets, the big ones. We were infecting training institutions for health workers, infecting hospitals, to the extent that we even infected some number of, police stations where we thought these viruses could be seen. These investments restored public confidence in the health system as the community's risk perception about the safety of healthcare facilities were managed. Let me, however, single out community healthcare workers and the role they played. Ghana has, for the past couple of decades, identified primary healthcare as a priority policy approach to reaching universal health coverage. And we made significant investments in expanding community health services, including increasing the number of community healthcare workers across the country. And they are all on government payroll, standing for normal service delivery and for emergencies. These investments paid off in the times of COVID-19, when the country needed to engage the community to deliver health service in a more dynamic way. Our observation showed that the COVID-19 response, including the COVID-19 vaccination exercise, have been more effective in regions where the community healthcare systems are much stronger. Our community health workers adapted the approach of service delivery from mass community gathering to more house-to-house visits and schedules antenatal and postnatal services, which ensured that mothers and their babies were not denied the needed service during the outbreak. Building on the trust that exists between the community health workers and the community, it has become more easier to change the community's perception about COVID-19 vaccines. Pablo, I think these are the type of interventions and things that we did to try to ensure that we could fight our battle successfully.
Minister Kwaku, thanks so much. I won't make Feng's work easier, but I do want to highlight the importance of the community health workforce and of primary health care in the way Ghana brought further resilience to the health system. Let me now turn it over with a great honor of having you with us, Honorable Minister Leopold from Bhutan. Bhutan has been recognized for a very strong community outreach and vaccine uptake precisely during these years. One of the characteristics that Minister Kwaku also referred to. Could you please share with us how has the country been able to develop such a strong community outreach in public health, and how did you make this a critical feature for resilience in Bhutan? Thanks so much for being with us, Minister. Over to you.
Thank you, Pablo. I hope I'm audible.
You're very well. Yes.
Thank you. I want to first begin by congratulating the World Bank team on this report. I think it provides the much needed framework for world to move forward and be prepared for the next pandemic. I think the component earlier mentioned were very much needed today as we plan our post-pandemic recovery. So to the team that has worked on the report, my humble gratitude. With that, I want to begin by saying, I think for Bhutan, when I look at today and reflect on what we have been through, Bhutan is a small country of 700,000 population, wedged between India and China, India in the south and China in the north, with a population of less than 1 million. When I look back, I think three things that comes to my mind. One is solidarity, science, and communication. I think these were the three main enablers for the success that we have achieved in terms of vaccination. Solidarity. Bhutan always having had a very good public health system. We have a lot of trust and confidence of our public in the health system. So there is and then this whole intervention being led by His Majesty the King, that again added an extra layer of confidence on the public. And of course, as I am sure most of you will know, Prime Minister is a surgeon. Our Prime Minister is a surgeon. So, and Health Minister with the health background, I think that again gives a lot of confidence to the public in terms of advocacy, in terms of informing the nation. So I think when I look at it, the solidarity, I think for a small country like Bhutan, I think every citizen realized when things were going extremely wrong around the world, that people realize that the small country that we call home is in danger. So that is where we had the whole of a society, whole of a government approach to responding to this this pandemic. Second, I want to echo the earlier presenter on science. Planning starts with evidence. Evidence-based planning and rolling out the implementation, understanding what we have, our own challenges. If you look at the WHO indicators, Bhutan's doctor to population ratio is 50% below. If you look at other health workforce, nurses, technicians, everything is 50% below. In the whole country, we have one ICU doctor. So that was a huge challenge for us. And what we did was that we did exactly what is in this report, which is task shifting. So we looked at strategic task shifting. What are the things that can be shifted to a non-medical individuals? So that is where we had a national level mobilization of volunteers, almost touching 45,000 volunteers on the ground, who are called the day soup, or the people in orange uniform. And they came to our rescue in terms of doing non-health related. And I think from that 45, we again task shifted and trained them on doing basic clinical work. And simultaneously, we had to tweak our legislations and our policies to accommodate this task shifting strategy. And then the last one is really communication. It is so important, especially during time of crisis, to communicate and be transparent to the public. And I think that gave us a lot of confidence. I remember almost for 2 years, I had press brief every single day, informing the country on what was happening, not just in country, but what was happening around the world. The literacy is very low in Bhutan. We have many remote communities. So we had to inform them. We have to inform them about the risks of this pandemic and its consequences, and how they can come in and participate. For risk communication, from day one, I think we launched something called our Genku in our local dialect, and it basically means our responsibility. And we call it with the tagline, responding to the call of the nation. So, and we did this aggressive media campaign using social media, mainstream media, basically saying we need to come together to protect our country. So when we actually started inoculation, people went to the vaccination poll with the level of energy that they were not only getting a shot on their arm, but this was something that they were saving their community, their relatives, elderly, vulnerable population, and they were doing something for the country. And that whole move was supported from the highest level by His Majesty, the Chief Abbot, So we had all these champions on board to roll this campaign out. So that's the very reason why Bhutan, for example, in the whole of the Southeast Asia region, we were able to inoculate 90% plus population in 5 days. And that's an approach that we took because we wanted to achieve the herd immunity in the shortest period of time. Because we realized if we are dealing with infection, community transmission in the country, it will be very, very difficult for us to mitigate given the limited health human resource we had. So these were the factors that really enabled us to do what we did. I also want to just touch base on the previous presenter on the supply chain. And that is something that I have been actively advocating for, both at the regional and global level, is that we must have a humanitarian corridor. Today, I'm someone who belongs to the health fraternity. When we look around the world, the lives that we have lost, which is an underestimation, our health workers who were lost their lives, who were sent out to manage the pandemic without access to PPEs. And for a small country like Bhutan, we also had acute shortage of PPEs. And if you remember the early part of pandemic, access to N95 masks was very, very difficult. So you are expecting the health worker to go out there and provide services without adequate PPEs being provided. And this is where I think we must not repeat this mistake. I think it is so important to have a humanitarian corridor for distribution of PPEs during pandemic. And this is where the equity comes into place. And I think these are things that I'm hoping that the report will capture, so that we are better prepared for the next pandemic that, who knows, might be right around the corner. So with that, again, my highest appreciation to the World Bank team who worked on it. I think it does provide an excellent framework for country to plan for the next pandemic, invest in preparedness, invest in building the capacity and the competency of health workforce and accessory workforce, not just in specific countries, but globally as well. So thank you, and back to you, Pablo.
Minister Leopold, thanks so much for this very strong experience and very concrete recommendations. Solidarity, pathway to universal health coverage, by the way, evidence and science, as Minister Kwaku also highlighted, and communication. And let me precisely on that, turning now to Rosemary, and listen from you and from your experience, Rosemary, your reflections quickly on a very important element behind resilience, and it's the close link that it has with trust. Based on your experience, what is the most important effort our governments should do in public health to bring this trust into health systems resilience? Over to you, Rosemary, and thanks so much for joining us today.
Thank you very much, Juan, distinguished panelists and all participants. It is true that resilience in health shocks is very closely related to public trust, and there are many things that one could do, or a government or a country could do, to strengthen public trust. I would like to focus on community engagement as one of the key entry points, because with community engagement, there are many things you can leverage around there to shape the public's perception and understanding of the crisis at hand, or their understanding and perception of the role and the leadership of the government, which really matters a lot when it comes to either behavior change, uptake of services, hand washing, wearing masks, and so on and so forth, in terms of the different elements that are very important for the crisis at hand. So thinking about COVID-19 in particular, I think, just thinking about the role of community engagement and how different levels at the community level, whether it's civil society, whether it's communities affected, whether it's community health workers, and the role that they can help in terms of shaping that public trust. But I want to look at within community engagement. I think different actors and players understand it differently, and there are critical elements that are important to make community engagement effective in building trust. So one is making sure that the process is co-created with communities. so that it is not tokenistic, it is not patronizing, but really there is a co-created process where communities are involved in decision-making processes. So that inclusion is very important. But also there is an element of investing in the capacity and understanding of communities of the crisis at hand. The extent to which we are ensuring that communities understand the science, the extent to which we ensure that communities can participate, and therefore really endeavoring to move from just community engagement and move towards community leadership, where communities are not just on the table to engage and really to be part of the process because it is needed or it's necessary, basically, or because it's a good thing to do, but really because we want that community leadership. And that helps a lot in shaping the perspectives of the public and the way we understand the whole process. But also, I think I want to also input to say that when we have the crisis, it is not the right time to build the trust. So we cannot wait until we have the next crisis for us to build this community engagement and this trust. It has to be now as we work towards the next crisis or as we work towards dealing with what we already have, because when the crisis is here, it is the time when people honestly least trust the public sector. It is the time when people least trust the government. It's the reality, because then it's a very porous situation where people are asking, are there political interests around these initiatives? Are there political interests around this information? And that just perpetuates the mistrust. And so building the trust now through community engagement and other mechanisms, inclusion, decision-making is very important, as opposed to waiting to do that when the crisis is here.
Rosemary, thanks so much. And extremely aligned, by the way, with the report and an excellent recommendation for all of our countries. We still have time to go quickly through each one of our panelists with a 1 to 2 minute response that can further strengthen your messages around resilience in health systems. Let me turn it very quickly to Minister Kwaku from Ghana. Ghana has been a pioneer in innovations, Minister Kwaku, and you have used them in testing throughout COVID. For example, you have also even gone to the utilization of drones and other innovations to strengthen the capacity of the health system and its resilience. Could you, in 1 or 2 minutes, share with us your thoughts about innovations being used to again strengthen more resilient health systems? Minister Kwaku, thanks again.
Thank you very much, Pablo. I think I said earlier that we had a strategy that included academia, research institutions, and the private sector. This approach made it easier for government to harvest innovative ideas from different or diverse teams. We used the drones at one stage as an adaptation of technology in COVID-19 response. When we started the battle, we had only 2 centers in the country, laboratories that can test PCR. So we were transporting samples from everywhere in the country, far north, middle belt, down to Accra, where we have 1 center, and then the other side, middle belt in Kumasi. So we were queuing, samples were queuing for testing. And we quickly decided to use the drones, and it worked very much for us. Apart from that, we quickly had to find a way to expand our test centers. And the gene expert cartridges, machines, equipment that we're using to do TB detection, we brought in cartridges quickly that could help us change technology in that respect to also adapt for COVID PCR testing. In the process, we expanded from 2 test centers to close to about 60 at the moment I actually speak to you. Collaboration with the private sector also yielded positive results. And COVID-19 Diseases Center was developed. We had actually converted one of our new hospitals that we hadn't started using into a test center. But then quickly, with the engagement of the private sector, they developed a fund that helped us put about 100-bed capacity treatment center close to what we have actually designed, so that the stress on our ICUs could be taken off a little bit to do some work for us. We learned lessons. And what biggest lesson we learned through the response process was that a delay in rolling out our intervention emergency period could have dire consequences, and that cost should not always be the basis for decision as one will expect in peacetime. So we invested despite the impact of the cost that will happen to us. And our president said that he would know how to bring back the economy to life, but wouldn't know how to actually bring back human beings to life. And that drove our innovative spirit to do a lot of things that we could do to fight our battle. Over to you, Pablo, and thank you very much.
Minister Kwaku, thanks to you. Thanks to you so much for sharing these experiences. And I'm looking forward, by the way, to visiting you in Ghana and learning from them. Minister Leopold.
Thank you so much. With greetings from Addis Ababa. I'm now in Ethiopia.
Thanks, sir. Minister Leopold, very quickly, we have competing priorities. We're facing different challenges in our health systems, NCDs, climate change, many other things, including infectious diseases, of course. How to prioritize in building resilience? What would be your answer from Bhutan in that prioritization of investments that we all need to do in strengthening our systems? Over to you, Minister.
Thank you, Pablo. I think if we were to look at specifically for Bhutan, I think the highest priority at the moment is investing in building the human capital, investing in building the competency and the capacity of our own peoples to be able to provide services at the time of crisis. I think for the Royal Government of Bhutan, this is a top priority. Second is building to build a resilient system. I think when we're talking about resilient system specific to the pandemic, I think we must have a robust surveillance system, not just in the country, but in the region and globally as well. And that is the biggest lesson we learned from this pandemic, is that we do not have a robust surveillance system. And this is not the first infectious disease we are dealing with. We have histories of 100 years of histories dealing with infectious disease, but yet again, we really don't have a robust surveillance system at this point. Neither do we have a platform for exchange of knowledge and ideas, for technical groups to come together and discuss and be very inclusive in their discussions. Not just take smaller countries or bigger countries, but I think having all the countries on board and understanding their health system. So for Bhutan, I think building in the human capital, building the competency and the capacity of our own people so that we are much more better equipped when we have our next pandemic. So that at the moment is the top priority for the Royal Government of Bhutan. Thank you, Pablo. Back to you.
Minister, thanks so much. And again, extremely clear message and very important one for our systems. Rosemary, very quickly in 1 minute, and building on your past response, including the non-crisis moments, misinformation. Misinformation is something we confront permanently in public health and in health. Would you dare in 1 minute to give us your recommendation on how to confront misinformation and avoid it from taking away from more resilient health systems? Over to you, Rosemary.
Yeah, so 2 quick recommendations on that. One is that, and it centers on risk communication. So with risk communication, one is that it shouldn't be like a one-way process of pushing information to the public, to communities. I think with risk communication, it's important we create a framework that provides feedback from communities back to the leadership. So hearing the concerns, the worries, the fears. A lot of times it's a one-way kind of channel for information. And I think that's something we can work on in terms of feedback. And the second recommendation is really about who is passing the information, who is doing the risk communication. And I think a lot of time we miss the opportunity to engage influencers. We miss the opportunity to engage civil society in terms of being a trusted actor within the space. Religious leaders as well as influencers, women's groups, young people, etc. But also the big role of community health workers, again, when it comes to being trusted agencies and really being on the ground and being very good agents for passing the right information. So I would highly recommend those two when it comes to risk communication and addressing misinformation to ensure compliance in a crisis.
Rosemary, thanks so much. I want to express a huge appreciation to our panel members. By the way, you've shared with us incredible knowledge and very important experiences that we will for sure keep very close to us as we work in our health systems. Let me now turn it over in the last 3 minutes to Feng Zhao, our practice manager in South Asia, to share his thoughts and reflections on this panel that we just heard about, fully aligned, Feng, by the way, with the flagship report on resilient health systems. Over to you, 3 minutes.
Thank you, Juan Pablo. It has been such a rich conversation, starting from Mamta's key message, the highlight of the video, and the 2 task team leaders' precise presentation, and the very insightful panelist comments. It has been wonderful, so I wouldn't dare even to summarize it, but I do want to share 3 quick reflections. The first one is this report came at the opportune time, at a critical time, when COVID has passed its peak, when health crisis is not the only game in town, when multiple priority has pressed the whole world, when the next pandemic, as Mamta mentioned, may come sooner than we have anticipated. So this report really gave us a way forward, to tell us how do we build a resilient system. As the way we handle this multiple diversified the world challenges. This is the way we can probably avoid another pandemic, another panic neglect cycle, as we probably already in the middle of it. So this report has created some intellectual underpinning for how do we move forward concretely, and also create some momentum for we continue this conversation. So that's one thing, the timing of it, I think is critical. The second one is investing in PPR, pandemic preparedness, and investing on health system strengthening don't have to be 2 parallel processes. They can be integrated under the foundation of the resilient health system, as the report and the presentation has highlighted. And so the report provides a concrete way forward and how do we get it done. The third one is we are facing very tight physical space. The framework of how do we invest in resilient health system provide a concrete suggestion and advice for global community, for country level decision makers to move this forward. I hope this will have impact on the country level investment. Minister Leopold, I will see you in 2 weeks. I'll be visiting Bhutan. I hope we can take this conversation further to discuss how we can help Bhutan to have an investment framework and system in place. I'm really impressed with the panel conversation. As Mamta said, resilience health system only can be led by countries, right? So the leadership is really critical here. I'm really encouraged by the determination, the innovation, and the investment vision coming out strongly with the 3 panelists. It has been a long process of the report, but the journey for building the resilient system has just begun. But today is a good day. And it's late in Bangkok, but I will definitely open a bottle of wine tonight. Thank you so much for your contribution.
Thanks so much for this very useful closing remarks on the panel. This brings us to the end of this event to launch the Resilient Health Systems flagship report. And I hope that all of us will take the time to go through it, to look in detail into the recommendations, into the observations, into the case studies that are brought forward in it. We can all learn from, as we saw in the panel, great examples that have and are being doing in strengthening health systems across the world. And it is a long journey. It's a journey that we all will need to walk together, and we need to start that journey immediately in order to be better prepared for future shocks. Change cannot wait. I want to close this event again with a huge appreciation to the authors, to all the participants, to our panelists, to Mamta and Feng, and everybody who has made this lunch event possible. Thanks so much. Goodbye.